Today is February 14th, Valentine's Day, and I'm going to talk about COVID vaccine stuff again. The topic I'm going to choose today has to do with what happens after I get the vaccine and can I take the mask off? Like so many of the other questions, I find myself thinking about these in terms of risk analysis. In other words, what is my risk of getting COVID after I've been vaccinated, and or what risk do I pose to other people if I walk around having been vaccinated with 2 doses of the vaccine and then taking my mask off and walking around in public. The scientific literature that informs us on these questions has to do with something called asymptomatic spread or asymptomatic transmission. This refers to individuals who contract COVID from somebody else before that person displays symptoms themselves, or if that person never displays symptoms at all. But understanding that those types of transmission events can happen will inform the discussion here. And most of the literature, as I read it, are descriptions of anecdotal events whereby a number of people have been infected by somebody they went to a dinner party with, or somebody who came to their home who was healthy at the time, and then later they found out that that person tested positive, and they assumed then that they got the virus from that individual. So despite my concerns about the quality of the science in this area, the compiled data, the large number of these anecdotal studies, is pretty convincing that asymptomatic spread does occur. And without getting into the literature, I can just say that it appears from my reading that it's really the day or two before an individual becomes symptomatic themselves that they are potentially infectious or contagious. And that period of time correlates with what we call a viral load, an increase in viral load. So if you were to swab that individual's nose 2 days before they came down with symptoms themselves, you would find the virus in there, and you would find increasing amounts of that virus into the period of their own disease. So you have the virus replicating in your airways shortly before you get the symptoms, and then that period of viral load, that period of viral replication increases for a week, perhaps, after you display the symptoms, and then typically it resolves within 2 weeks. So the viral load then will go down after a couple weeks. While you are symptomatic, you're clearly infectious, and that, for the most part, that correlates with most of the identifiable transmission events. And this brings me to the question about vaccinated individuals and whether they represent a danger to other individuals if they go around without a mask on, and then vice versa, what risk do they have walking around in public without their mask? So let's put a human face on this and say my mother-in-law, Maria, who actually raised this question on a Zoom call the other day, let's say she gets her second vaccine and she's ready to go out into public without her mask. What is her risk of getting infected and getting symptoms of COVID? So the answer to that question is actually twofold. One part of this is the frequency that vaccinated individuals do not raise neutralizing antibodies. And if you listen to my previous videos, I talked about 95% effectiveness of the Moderna and Pfizer vaccines. So Maria would have a 5% chance that she was not protected herself, that the vaccine did not work for her, that she did not raise sufficient neutralizing antibodies. The other scenario is that she did get successfully vaccinated, but she doesn't have sufficient antibodies to prevent the virus from infecting her she does, she is protected from illness or maybe severe illness because she has this immune response. But the virus can enter her airways and it can, for some period of time, reside in her throat and lungs and nose. So, does she represent a risk to other people? The answer to that goes back to this question of asymptomatic or pre-symptomatic spreading. If Maria is one of these 5% of people and she gets in contact with somebody who has the disease and she becomes infected, she will be a risk to other people during this pre-symptomatic period of time. In fact, she'll be a risk to, people while she's symptomatic as well. But you have to ask yourself, what is that math? How do you assess that risk? I mean, there's a real number that you could probably calculate there, but it's going to be a small number. Assessing Maria's own risk, she'll have to think of that herself. Am I comfortable walking around in public knowing that I have a 1 in 20 chance of not being protected by the vaccine? Obviously there's more complicating factors there. What stage of the pandemic are we in? Are there people around me who've recently been tested or not tested? Are there people in the community that have COVID? Those kinds of questions would impact her ability to decide for herself what her level of risk would be. But from the public health perspective and the assessment of what risk Maria would have to the public, or the risk that she might be an asymptomatic or pre-symptomatic spreader, this is a question that hasn't been answered yet scientifically. I don't see in the literature good evidence that this is happening amongst vaccinated people. The vaccine program hasn't been going on long enough to really answer these questions. So now let's turn it around and think about it in terms of the public's perception of risk. What risk do I perceive about being around Maria or somebody who's told me that they've received both doses of the vaccine and now they're taking their mask off? And to go back to what I said before, it's really about an assessment of what my level of risk would be. Let me try to put this in mathematical terms. This is called 19andme.covid19.mathematica.org. You can go to this site, and I think there's a couple others that do something similar. So let me see if I can move myself out of the way here so I can show you what I'm talking about. This website you get some questions, or you have to provide some information here, and I'll try to scroll down here so you can see what I've entered here. It shows the zip code where I live, and so based on that zip code you get the prevalence of the COVID cases in your area. I've entered my age, so there's risk factors associated with age. Obviously, you enter your sex, you enter whether you've had pre-existing conditions, which I don't, and then there's some behavioral questions. How many people do you live with? How many people do you come in contact with? Are you following the hand hygiene recommendations from the CDC and the personal protection equipment, which I assume means masks, and then your vaccination status? And so all of this information goes into an algorithm, which then gives you a calculation and a score. My score being 44. I guess that's 44 out of 100. So I assume that's a good score. So this is kind of interesting because of the information it tells you about what the prevalence of the number of COVID patients is. For example, 1 in every 248 people in my county apparently are currently infected with COVID. And then if you scroll down here, risk of contracting COVID-19. So based on the information that I provided, the estimated probability of catching COVID-19 through community transmission in a week is 0.019%. That's 1.9 in 10,000. And for comparison, 0.41% of Americans catch the flu every week during flu season. So this is comforting in a way that my risk is really low. And that's for somebody who's not been vaccinated. And of course, if you want to calculate what's my risk of being hospitalized or even dying from COVID, it's going to be a small fraction of this number yet. So I really take comfort in these kinds of calculations, and it gives me some mental sense of knowing that this is really not that high of a risk that I'm going to be in the hospital or even get real seriously sick from this disease if I get it at all. So if somebody like Maria or somebody who's been vaccinated went onto this website and entered that they had been vaccinated, I'm guessing that the percentage is going to be even smaller than 0.019%. Obviously, there's different variables, and this website accounts for just a handful of them. But to go back to the question that I addressed before, do I perceive a risk in being in the same room with somebody who's been vaccinated who's not wearing a mask? No, I don't. Um, could it happen that I could get the virus from a person like that? Yeah, it could happen, but I could also get struck by lightning, or I could, get killed by a gunshot wound. I mean, the risks of things like that, or car accident, I mean, the risks like things like that are significantly higher than what I perceive the risk to be from being in contact with a vaccinated person. Does that mean I think Maria should be free to go about coughing on people? Of course not. And she should be aware of who she's interacting with. She should be aware of other people who may have comorbidities, who may be in an advanced age, and clearly they're going to be sensitive to being in public and at risk with somebody who doesn't have a mask on. But to address the question, is somebody like that putting the public at risk? I really feel like the answer to that is no. But what does it hurt to wear a mask for another month until more of the general public is vaccinated? So would I feel at risk if Maria came without a mask to my house? No, I would not feel at risk. I'd be 1,000 times more likely to commit suicide from listening to her carry on about Donald Trump or something political than I would be about contracting COVID from her. So I say that as a joke, right? But there's a real point to be made there too, because with the lockdowns and the restrictions about moving around and social distancing, there's serious societal costs which are collateral to the infectious disease problem. People are shut in, they're drinking more, they're abusing their spouses more, and suicides are on the rise. So these are serious problems, and people are going crazy because of the lockdown. So when the risks come down to the public, I'm an advocate of reopening the schools, reopening businesses, letting people return to their normal lives. And of course, let's protect our senior citizens. Let's protect people in the nursing homes. And I think we have a strategy to do that. But let's not be consumed by fear. However minute the risk may remain by vaccinating people going out in public without masks on, let's not let that fear consume us to the point where all these secondary problems are just exacerbated. So in summary, I just say know your risk, and don't freak out if you see some elderly people without their masks on because they've been vaccinated. To me, I'll feel better about that, because I'm going to interpret that as those people are vaccinated and they feel comfortable about moving out into public again. And if they do happen to be one of those small fraction of people who got vaccinated but still for whatever reason got infected, and they're in this pre-symptomatic period of time, just keep your distance from them and you'll be fine. And should you look at them as some sort of super spreader? No. the science is not there. I mean, there's no evidence that those vaccinated people can spread the disease. We don't know that they can't either, so it's safe. If you want to be super safe as a public health official, you're going to advise the public to keep the masks on and assume, even if you have been vaccinated, that you could potentially get the disease and spread it. And so, I may be wrong, but I'm going to look at this optimistically and think and say that the effectiveness data that we're hearing from Pfizer and Moderna is going to predict that those people are not going to spread the disease. In other words, the vaccinated group of people are not going to be responsible for continuing the pandemic. There's a few other things that we could talk about, like coronavirus variants, which maybe in the future we might hear about the need to raise alternative or different vaccines. The evidence appears to be that the vaccines will be effective against these alternative strains or the new strains. That may not be the case in the future. The coronavirus may mutate enough to avoid the immune response that people are getting from the vaccines. But for now, it looks promising that we're going to be protected from both or multiple coronavirus strains. So that's it for now. I'll try to attack some of the other questions that I've been getting soon, but I hope everybody's doing well, and I'll talk to you again soon.